much. I'm very honored to be here tonight and hope that you guys will glean something from the brief presentation that I'm going to give you. Carol contacted me a few months ago and was interested in me giving a presentation to you all based on postural considerations, how you use your body throughout the day and how that might influence the discomfort and pain that you go through throughout the course of the disorders that you deal with. So that's what I'm going to emphasize and focus on tonight. So with no further ado, we'll go into discussing postural guidelines and helpful habits to minimize body strain. Some of the things that we'll be talking about tonight, we'll be reviewing the anatomy of the spine and the jaw. We'll discuss possible sources and causes of neck, back, and jaw pain. We'll heavily emphasize the importance of proper posture and positioning and how that can minimize strain and stress to your body. We'll touch on cardiovascular exercise and general fitness and why that's important and why you need to approach it in an appropriate manner considering your personal deficits or issues. And also briefly touch on self-management of pain and what you can do to try and control symptoms as they present. So first off, I want to talk about the anatomy of the spine. Here you'll see a picture of the vertebral column. You'll notice that the spine is not just one block. It is made up of small pieces that we call vertebrae. The top vertebrae are what we call cervical vertebrae. They're made up of 7 vertebrae bones there. That's what we call your neck. The middle portion of your back is made up of 12 thoracic vertebrae. The thoracic spine links the neck to the lower back. Then at the base of your spine, at the bottom of your spine, the movable parts there we call your 5 lumbar vertebrae. And that's what we commonly refer to as your low back, but you also need to consider what's below those movable lumbar vertebrae, 5 fused sacral vertebrae and 4 coccygeal vertebrae, which we also refer to as your tailbone. Those also make up a portion of your lower back. What's important to notice from this slide here is that there's a natural curvature of your spine. From an engineering perspective, this enables your body to sustain a tremendous amount of strain and stress. Maintaining the natural curvature of your spine is so important in the prevention of many musculoskeletal injuries and a lot of muscular pain syndromes. And unfortunately, so many of us deviate from this natural curvature of our spine with acquired poor postures throughout the course of our lifetime. So it's just wanted to give you a little visual here because we'll be discussing poor postures and abnormal curvature a little further into the presentation tonight. I first want to talk about what the temporomandibular joint is, or TMJ. This is the joint that connects the temporal bone of the skull to the mandible of the face. So it's simply named after the 2 bones that it connects. And I wanted to mention the TMJ here, the temporomandibular joint here, because so many people who struggle with fibromyalgia or fatigue-related syndromes and chronic fatigue have issues with their jaw. And so I just want to give you a little bit of information about what might be going on there. The TMJ is a synovial joint. That means that it makes it dependent on movement for nourishment. A synovial joint refers to the fact that the joint itself is surrounded by a capsule. That capsule is kind of like a Ziploc baggie that surrounds the bony structures of your joints. The inside of that capsule secretes what we call synovial fluid. And that fluid is what provides nourishment for the joint to keep it protected and healthy throughout the length of your lifetime. So that's all that word synovial means. Because of the fact that the synovial fluid is what provides nourishment to the joint, a synovial joint always depends on movement of the joint for circulation of that fluid so that the joint can stay healthy throughout the course of your lifetime. I want to talk briefly here about pelvic bones and joints. The SI joints refers to the sacroiliac joints. Again, this is just named after the bony structures that are connected. The sacrum of your lower back meets the ilium of your pelvis, and that's why we call it the sacroiliac joints, or SI joints. These joints are extremely important because they support the entire weight of your body and your spine, and they transfer energy from your legs into the spine and upper body. So they're kind of like a control center in your body. Due to the important job that these joints have, they must remain strong and stable throughout your lifetime. These joints are also unique in that muscles don't directly control movement of these joints. Instead, these joints respond to how the rest of the body is moving, and they move accordingly. So that makes it very unique, but also makes it a source of dysfunction in many individuals. especially women more so than men, because of the high amount of ligaments that the joint relies on to stay stable. And those ligaments are influenced by the hormones that are released in all of our bodies, but in particular in women's bodies, especially during and surrounding pregnancy. I want to spend a good bit of time talking about muscles and their function, because I believe that a lot of research has gone into the impact of exercise and the use of exercise as a treatment modality for people who suffer with fibromyalgia and fatigue-related syndromes. However, exercising just any old way is not appropriate. You can easily make your symptoms worse and send yourself deeper into a cycle by exercising incorrectly. And so I want to educate you a little bit about muscles and their function, so you can understand the correct forms of exercise a little bit better. Many people suffer from musculoskeletal dysfunction and pain due to poor posture in chronically misaligned bodies. This is in large part due to the way that we use our bodies throughout the course of our days, throughout the course of our lifetimes, just as the patterning society has kind of embedded in us, such as driving all over creation to get to and from work and to and from our homes or whatever we're doing. A lot of our jobs are very repetitive in nature and have us involved doing repeated movements over the course of our working hours, and that puts a lot of strain and can contribute to imbalances in our bodies as well. This poor posture and chronic malalignment is in part due to a lack of understanding of the importance of body symmetry and muscle balance in protecting the integrity of your body structures, as well as a lack of understanding of muscle function. Now I want to briefly touch base here on what I mean by body symmetry and muscle balance. It's really important that things are functioning equally through equal range of motion and with equal strength on each side of your body, and that there's a balance in flexibility and strength in those muscles from one side of your body to the other, as well as a proper balance of strength and flexibility in the muscles in the front of your body and in the back of your body. So many of us develop chronically malaligned bodies and poor postures because everything we do is in the front of our body, whether it be typing, reading, cooking dinner, and what happens is everything up here gets really, really tight, and we start to lose our good posture and become really, really rounded. And as we become really, really tight in the fronts of our chest and in the fronts of our bodies, everything in the back becomes overstretched. And when it's overstretched, it's not able to be as strong and provide the stability that your body needs to prevent you from developing musculoskeletal problems as you're going about your daily activities. Now I want to touch base on muscles and their role in producing stability in your body versus producing strength in your body. That's a big difference that a lot of people don't understand or don't educate patients about, and I think that it really plays a key role in people who suffer from any sort of musculoskeletal dysfunction. We have a tendency to utilize the muscles in our bodies that we can see and that we can feel. However, body alignment is most typically dependent on muscles that we can't see and therefore have a difficult time feeling. The muscles just under our skin are muscles that are responsible for strength and power. These are the muscles that help us to climb up the stairs or stand up from a seated position. And while they're very important, it's also important to address the muscles that stabilize our bodies and provide a foundation from which those strong muscles can move. These are muscles. Without these muscles, we couldn't move our limbs. However, there are muscles that lie deeper to these superficial muscles that must work to stabilize our bodies prior to activating the muscles that create strength and movement. If they're not working to stabilize our bodies, then the activation of our muscles that produces movements will cause excessive wear and tear to our bodies. So what I'm trying to get across is that there are muscles that provide a foundation from which other muscles work. Most people develop problems, especially spinal problems, because they think that their spine and the structures that make up our core or our spine, their job, they think, is supposed to help our arms move or help our legs move. And that's not the case. The supporting musculature around the spine is meant to keep the spine still and stable, to provide a foundation from which your arms and from which your legs move. And learning to use your body appropriately like that, dissociating or being able to move the arms and the legs independently of movement of the spine is critical to prevent you from developing problems and wear and tear of your body over time. When your strength muscles, those superficial muscles that you can see and feel, your biceps muscles or your stomach muscles, those six-pack muscles that are so elusive to many of us, but which are portrayed across televisions every single day that we're watching TV, those muscles are important in that they help us to lift a gallon of milk, or they help us to open up a cabinet. But unless the deeper muscles are working to stabilize our joints before the movement occurs, excessive wear and tear will occur and cause problems. Not with one incident of doing that, but over a period of 5, 10, or 20 years of doing things without stabilizing the joints prior to moving them. So I'm going to stop with that there. Most people don't know that these deep stabilizing muscles exist, so they don't know how to exercise them. However, if these muscles are not addressed, then it's only a matter of time before we start to develop musculoskeletal problems and therefore pain, and you get stuck in a vicious cycle. So I want to talk about what some of those deep muscles are to kind of give you an idea of where they lie so you can start to understand them and try to start to feel them. The transversus abdominis is the deepest layer of your stomach muscles, and it connects all the way from the front of your spine all the way to the back. So as such, it is your body's natural girdle of strength, natural girdle of support. This muscle is really, really important to the core stabilizing musculature that was alluded to in my bio in the beginning. And we'll discuss that in deeper detail in a few slides. Other deep spinal stabilizing musculature that you can't see and that you can't feel because muscles overlie it include the multifidus and the suboccipital extensors. The multifidus are tiny muscles that crisscross between one vertebrae of the spine and the next, and as such, they provide stability at each particular level of the spine. Remember, it's important to understand that the spine is not one unit. It's made of individual segments that have to work in concert with each other, both via stability and movement, to allow you to function optimally without pain. The suboccipital extensors are really, really important. Those are the muscles that are shown there right from the base of the skull to the very top of the spine. Those muscles become really, really tight and short in so many people and are a frequent source of headaches for folks. Those muscles become short because most of us don't have ideal posture as we should, but we rest with our head forward of the rest of our body. This creates a chronic shortening of those muscles that I termed the suboccipital extensors. And what's important to recognize about that is that there are a great number of nerves that pass from out underneath the skull through those muscles to supply your head and your neck, and those muscles become pinched from that chronically tightened muscle. That pinching creates inflammation, which can then make you experience headaches. The neck flexors from the front are also really important. These are muscles really, really deep. Again, so many muscles, 2 or 3 other layers of muscles have been removed so that you can see this here. I just want you to have a visual of where those bones lie. The deep muscles are the muscles that lie closest to the joints that they're trying to control. And in this case, we're talking about joint control in the neck, in the vertebrae that make up the neck. Your scapular stabilizers are the muscles that support your shoulder blades, and these are critical for anybody who struggles with shoulder problems, headaches, neck pain, jaw dysfunction. Your shoulder blade is really the foundation from which so many muscles that produce head and neck and arm movement arise. So the shoulder blades themselves have to be really stable so the foundation can be strong so that the muscles that control movement of your arm or control movement of your neck have a solid foundation to work upon. If the foundation isn't stable, if the scapula itself is not stable, then the muscles that move your arm or the muscles that move your neck have to try and fill a dual role. They have to try to stabilize the shoulder blade at the same time as moving the body part they're trying to move. So in essence, you're asking someone to work double overtime all day long without reimbursing them for it by the end of the day. And that's when you develop a lot of pain and tension and soreness in those muscles because they're simply working too hard and trying to do too much. The scapular stabilizers here connect the shoulder blade to the neck and to the spine and to the shoulder. Also here you can see that some of the muscles that make up the rotator cuff originate from the shoulder blade itself. The rotator cuff muscles is a group of 4 muscles that controls movement and positioning of your shoulder. I put this slide here because the pelvic floor musculature is again something we don't talk about, we don't see, we don't hear alluded to, but it's really, really, really important for stability of your entire body. The SI joints that we talked to earlier, I showed you a slide of them, but I didn't really show you where we were talking about. We're talking about the region of your hips and pelvis. So we're talking about this region through here. This is your center. This is where energy is transferred from your lower body up into your upper body, and this is the control center. Okay, so this joint has to be really, really inherently stable, but unfortunately in many people it's inherently unstable. It really relies on the muscles that surround it to support it and keep it in an aligned position. The pelvic floor muscles are key muscles to do so. Here in this picture, we're taking the pelvis, which is kind of like a bowl right here in the center of your body, and we're looking down into it. Okay, so this is your visual here. I'm lying down on the table, you're inside my stomach and looking straight down. Okay, these muscles here you can see connect. They act like a hammock that connect the front of the pelvis to the base of the spine, to your tailbone and to your sacrum. And as such, these muscles support the entire weight of your spine and the abdominal contents. If these muscles aren't strong, then your stomach is not supported, your gallbladder, your uterus if you're a woman, your kidneys, all of these muscles are just kind of hanging out without any support from below. It's kind of like you standing on stand versus standing on solid ground, how you feel a bit unstable when you're doing so, especially if you're moving. So that's why I've mentioned the pelvic floor musculature here. Really, really critical, even though it doesn't get addressed frequently enough. So here's that elusive core stabilizing musculature that I've been talking about. I want you to look at this slide here and notice that the muscles that I'm about to point out to you form a tight capsule. We want to try and get these muscles to coordinate and work together to create this tight capsule so that the muscles of the movement of your arms and your legs can be founded and grounded from these muscles here. The ceiling, or the top of that capsule, is your diaphragm, the muscle that controls your breathing, and that's countered by the pelvic floor, the muscles from below that we just alluded to on the last slide. The muscles on the front are that deep transversus abdominis that we were talking about, and in the back are the multifidus. All of these muscles join and connect to form this tight capsule to be a foundation from which your arms and legs can move, and to keep your spine stable while you do so. I want to briefly discuss a few exercises that help you to engage the stabilizing musculature. It's really challenging for people to do so when they're not used to doing so, and I want to explain a little bit before I show you. It's important to recognize that the stabilizing musculature does not respond in the same way that our superficial and strong muscles do. We're used to trying to create a lot of force when we activate muscles. We're trying to push, we're trying to pull, we're trying to curl or crunch. But if you do this in the case of the stabilizing musculature, then those muscles will never become activated. And the superficial mobilizers will be activated to an even greater extent, and then you're going to ask them to do that dual role of creating stability while at the same time creating movement. I want to talk a little bit about the fact that your muscles of your body have 3 different layers. Those 3 different layers also have 3 different roles. I've already talked a lot about the superficial muscles, the muscles that you can see and feel in your body. Those are the muscles that you're used to activating. You're used to activating those muscles, and I'm going to use the analogy of the intensity or the volume of your voice. When you ask your muscles to do something, like picking up this, if this was a gallon of milk or my small bottle of water, I'm yelling at the muscle to try and get it to accomplish what I want it to do. At the same time, I need to be whispering to my deep stabilizing muscles to get them to activate and stabilize prior to yelling at these muscles to do the work. So it's almost as if you take a brief half a second and stabilize before you create movement at any joint in order to prevent yourself from developing problems over time. Again, this is not something that creates a problem, a traumatic accident, and you can see the influence immediately. This is the people that develop pain. Well, you know, I never had problems before, and now I'm 35, or now I'm 50, and all of a sudden I'm starting to feel those problems. It's not because anything is different now than it was 35 years ago, other than you're older, but what it has to do is the fact that you've used and abused your body. You've used your body incorrectly so many years that at some point your body just says, I can't do this anymore, and it's letting you know. In order to activate the deep stabilizing musculature, you have to make a very, very gentle attempt. It's very subtle, and so it's therefore difficult to master. Most people, because of this, require one-on-one instruction to master those exercises. So it's important for you to understand that if these exercises irritate your symptoms, then they're not appropriate for you to perform, either because they're simply not appropriate, they're not what you need, or you're not doing them correctly. So don't attempt them if that's the case. There is no such thing as no pain or no gain in any form of rehab, regardless of the fact that physical therapists are often called physical terrorists or other various and sundry applications of our name. It's simply not true, especially when you take into consideration the fact that people suffer from problems such as fibromyalgia or other fatigue-related disorders. So I want to discuss an exercise that is listed here on the computer screen and on your handout called the abdominal draw-in and the pelvic elevator. It's really two exercises that we combine together. I'm going to start with the pelvic elevator. We talked about the pelvic floor a moment ago, and many women who have had babies might be familiar with these exercises or these muscles because when you were pregnant, many people asked you to perform Kegel exercises. That's activating the muscles of your pelvic floor. For a woman, the cue to doing the pelvic floor muscle contraction is stopping and starting the flow of urine. For a man, it's typically giving them a cue of trying to prevent yourself from passing gas. So you're just trying to activate those deep muscles in your groin and in your bottom. So what the pelvic elevator is, rather than simply tightening those muscles, if these are the muscles that stop and start the flow of urine, these are the muscles I'm activating. I'm drawing them together and I'm lifting up. Now, I'm not doing this. The muscles don't move that far. It's a very small, subtle thing. You're moving maybe a millimeter, as if you're trying to draw those muscles up and into your pelvis and into your body. What the abdominal draw-in is activating the deepest muscles of your stomach. So often, when we think of doing abdominal exercises, we really pooch those muscles up towards the ceiling or out away as we're trying to kind of create a fist with those muscles, when in actuality we should be trying to flatten those muscles as much as possible. What you want to do to activate these muscles, and you can all try it with me now if you want to, is just place your hands on your stomach and keep your stomach really relaxed. What I want you to do is purse your lips and blow out a candle as you try to draw your belly button into your spine. It's a really small movement. It's not big. You can activate the wrong muscles by trying too hard. I'm not asking you to do and create movement. It's just a very small, subtle drawing in. And what you want to try to do is combine that with that pelvic elevator. So you get a little lift through your pelvic floor and then draw your belly button into your spine. Almost as if there's a zipper from your pubic bones all the way up to the bottom of your rib cage, and you're just slowly zipping it up as you breathe out. Now, it's really important that you activate those muscles as you breathe out. Most people incorrectly try to activate those muscles by breathing in. And when you do that, you're not using your deep stomach muscles, you're using your diaphragm, which is not the way that we want you to do this exercise. I have 3 positions shown here because some people have a hard time trying to activate these muscles, and these positions show a progression. It's typically easiest for you to activate these muscles when you're in a position of your hands and knees, followed by lying flat on your stomach, followed by lying on your back with your knees bent. You always want to lie on your back with your knees bent to protect your low back from developing strain and stress. So that's the pelvic elevator and abdominal draw-in. Next, I want to talk about scapular retraction. So many people, when they've been treated for jaw dysfunction or neck problems, they've been asked to do big shoulder rolls or big scapular squeezes where they're really squeezing the muscles together around their shoulder blades. That's using the muscles that produce strength and movement versus using the muscles that create stability, okay? So again, you want to try and draw the shoulder blades a little closer together, but you're not doing it in such a way that you actually see a big movement. It's maybe movement of a ½ inch to an inch on each shoulder blade. So here I had my assistant lift her arms overhead. That's typically easier to be able to activate those muscles. And I'm just going to turn around and first show you the incorrect way to do it, followed by the correct way. Sitting from where you are, you're not going to notice a difference when I do it the correct way. You'll be able to see movement when I do it incorrectly, but learning to stabilize and do that subtle movement to stabilize is something you can't really see. So I'm going to do it incorrectly first and then correctly. And then, so again, you probably didn't see much movement when I was doing it correctly. It was a gentle gliding together of my shoulder blades. If my shoulder blades are here, it wasn't moving like this. It was merely moving like that. And that's what stability of your shoulder blades is. Learning to activate those muscles to provide a solid foundation from which the arms that control neck and shoulder movements from the muscles that control neck and shoulder movements work is really, really important. Finally, another exercise that engages the stabilizers is an exercise we call head nods. Again, if you look on the screen, there's a very small, subtle difference in the position of her head on her neck. A lot of times when you've gone to therapy, if you've been to therapy in the past, some people may have told you to do an exercise called a chin tuck and teach you to draw your head way back. That actually tends to increase people's problems versus try and help them recuperate from their problems, as we're trying to do. What you're trying to do here, because we talked about earlier those suboccipital extensors, the muscles in the base of your skull that connect to your upper neck, they become so tight because your head is forward much of the day. All we're trying to do here is create some length through them by gently nodding your head. Just a very small movement versus really big and pulling back. So in these exercises, if you're doing them correctly, most people won't know that you're doing much. Okay, it shouldn't be obvious. So now I want to switch gears, not talking about exercise so much, but talking about the effective posture on your body. I want to use this illustration here of sitting with proper upright posture and sitting with poor posture. When you sit upright, well, first of all, your head weighs approximately 10 to 12 pounds. When you're sitting upright, your muscles have to work to hold up what they recognize as a 10 to 12 pound object. Okay? So they're working just their regular job, what they're designed to do, what they're asked to do. However, when you sit slumped, as in the bottom picture, with your head forward, your shoulders rounded, obviously you haven't changed the weight of your head. It still weighs 10 to 12 pounds. But by changing the relationship of your head to your neck, you've asked the muscles to hold up an object that they consider weighs 36 pounds. So it's no wonder by the end of your day you're so tight and sore here, because those muscles are working triple overtime all day long and they just can't handle it. And one of the best things that you can do to try and minimize that is address your posture. So we're going to spend some time on that right now. Here is ideal, what we call neutral spine posture. When I talk about neutral spine, what I'm talking about is maintaining the natural curvatures of your spine that we saw in one of the earliest slides. In neutral spine posture, you should look as this young lady does here. Her ears are stacked directly over her shoulders, shoulders over her hips, hips over her knees, belly button drawn into the spine as we practiced not too long ago. Chest is lifted, not crunched down facing the floor, but almost lifted up to the ceiling. String attached to the crown of your head, pulling you up, trying to make you taller, versus most of us just kind of sink and collapse into our bodies instead of trying to feel ourselves as being taller than we actually are. This is proper neutral spine posture and what we should get in the habit of feeling and doing. A great test to know if you have ideal spinal alignment is just simply to stand against a wall. Ideally, when you're standing against a wall, the back of your head, your shoulders and shoulder blades, and your sacrum, which is the lowest part of your bottom here, will touch. They'll touch the wall, and the heels of your feet will be relatively close to touching the wall. There should be a small space right here between the curve of your neck and the small curve in your lower back, indicating maintenance of natural spine curvatures. So that's a quick test, and I guarantee you when you guys go home and if you try this test, you're going to find that you are way off of what ideal posture is. And when you try to get into that ideal posture, it's going to be uncomfortable. It may actually physically be a bit painful because you're so far away from what you're used to doing. And you're going to feel like a robot. You'll feel like there's no way that this is natural. And it's true, you do feel like a robot, but it's only because we use our bodies correctly until we're about 2 or 3 years old, and then when we send kids to preschool and ask them to sit and stay still and just sit in chairs all day long rather than freely using our bodies, that's when we start to develop all kinds of problems that become not problematic when we're 2, even when we're 18, but later on down the road we start to feel it. I want to discuss postural deviations. This is, again, a take on the natural curvatures of your spine that we alluded to earlier. In a kyphotic lordotic posture, there's an exaggeration of the natural curvatures of your spine. Kyphotic just means extension of kyphosis. Lordotic is an extension of your lordosis. And these are just terms that we use to describe the shape of the curves in your spine. A flat back posture is where you have a loss of curvature of your spine. A sway back posture is where the hips are thrust forward, your center of gravity, so your upper body swoops forward to try and catch up for it, to try and stay balanced. And then everybody's favorite, I'm sure you're all familiar with the slump sitting posture, because I'm sure you position yourself like that frequently, only to end up hurting afterwards. So, what can you do to sit with good posture and minimize spinal strain? One thing you can do is scoot all the way to the back of your chair. This will prevent your pelvis from rolling forward and back and provide you a little bit of stability. You can also use a back support to try and maintain the natural curvature of your spine. This can mean going out and purchasing a back support, and there are many good back supports out there, but I've never invested in one. All I do is I roll up a washcloth or a t-shirt or a small hand towel and place it in the small of my back. It's amazing. If you restore the curve in your lower back, it really helps restore optimal alignment in your upper back and upper body as well. When you're slumping in your lower back, here, if I just adjust the curve here, it makes everything else straighten up. So using a back support is a really good idea. You can sit on the edge of your chair. When you sit on the edge of your chair, there's nothing to slump into. So your muscles have to work to support your body weight in an upright posture. You should change positions frequently. Your body was not created or designed to stay in the same position all day long. You should never be in the same position for longer than 20 or 30 minutes at a time. So, for example, being in this presentation, in the introduction they said to stand up and walk around if you need to. I fully support that opinion. Your body is not designed to sit in classrooms or at work or at your desk for an extended period of time. Changing positions can frequently be scooting from the back of your chair to the front of your chair, standing up for 10 or 15 seconds. When I tell people they shouldn't be in the same position for longer than 20 or 30 minutes at a time, and they have jobs where they have to do a lot of desk work, they tell me there's no way they can afford to take rest breaks that frequently. Well, can you afford to pay a massage therapist or a physical therapist or a chiropractor for treatment once a week for the rest of your life? What I mean is that you don't have to take a 5 or 10 minute rest break every 30 minutes. It's simply standing up for 10 or 15 seconds, giving your body a break, doing a few simple stretches, and sitting back down and going about your business. It can mean taking a phone call standing up versus taking all of your phone calls sitting down. Even the position that you sleep in at night is important. You should wake up feeling refreshed. You should not feel worse when you wake up in the morning than when you went to bed the night before. So much of that can be due to the way that you're sleeping, the way that you're positioning yourself at night. Using pillows to help prop you up in a good upright posture is really, really key. It can be very helpful for many people. Special supportive neck pillows are helpful, especially if you have any neck issues, headache issues, or jaw issues, and they have a really great selection of pillows at the Relax the Back store across from Cottonwood Mall and Holiday. The most important thing when choosing a supportive pillow for your neck is not to buy what someone tells you to buy, but for you to try out the pillow that you're intending to buy to see if it works for your body. Another therapist at my clinic swears by one of the pillows we sell to our patients, and I swear by the other pillow that we sell to our patients. So it's not that one pillow is better than the other, it's that your bodies are different and you're going to respond differently to different things. So try out anything that you're going to use before you buy it to make sure it's going to work for you. Notice here how we use pillows to support our body in good posture. When you're sleeping on your back, always use 1 or 2 pillows underneath your knees. This minimizes the strain and stress to your lower back. When you're lying on your back, use no more than 1 pillow underneath your neck. You don't want to foster that forward head posture even when you're sleeping. That's so much a part of what develops pain by the end of your day. You don't want to continue to do it while you're asleep at night. When you're lying on your side, pillows can be your best friend. Always using 1 or 2 pillows between your knees, more if you're a woman because our pelvises are wider than that of a man, so it puts more strain on our back when our knees come together when we're lying on our side, if the pillows aren't there. Also, notice that she's using a pillow underneath her arm to support her arm in a good position so that it's not rolling forward in front of our body and causing our whole body to roll forward throughout the night. Using these pillows can significantly enable your muscles to get the rest that they need while you're sleeping, since you put them through so much abuse throughout your daily activities. Reading in bed. Do and don't. And I'm sure that we all do the don't. But rather than bringing your head up to meet the book, you should bring the book up to meet your head. And the biggest argument that I get from my patients is, well, the book is too heavy. I can't do that. Well, I don't know what books you guys are reading. I'm not reading a book that's that heavy, that thick. But you can also use some pillows on your stomach to kind of rest your forearms on so that you're not working so hard to hold the book upright. Or lie on your side, read the book on your side, or sit up. Just don't read like that because you're going to end up in pain the next day.
I've got a really weird question, but I thought it was bad to read books, period, in your bed.
It depends on what perspective you're going from. If you're someone who has difficulty going to sleep and you're just trying to reserve your bed for just your sleep time, then yes, that would be the case. But a lot of people do read to try and put themselves to sleep at night. I can't answer that question. That's going to be very individual. But if you are someone who can read in bed, just don't do it this way. So, body mechanics. What types of activities do we do that require us to focus on good body mechanics? Lifting, chores, childcare, driving, personal hygiene, work activities, sex, sports, reading. In short, absolutely everything you do requires you to focus on the way that you move your bodies to accomplish it in order to prevent injury. So body mechanics basics. When you're doing any of these activities, working, housework, personal hygiene, you always want to make sure that you're maintaining that neutral spine posture, not that slumped and rounded posture. You want to brace or draw in your abdominal musculature and your pelvic floor to activate your core and provide you with stability. You should keep objects close to your body while you're carrying it. If this object weighs 10 pounds and I'm carrying it close to my body, then my spine knows that I'm holding up a 10-pound object. But if I hold that same 10-pound object at arm's length away from my body, then what I've done is I've imposed 100 pounds of stress on my spine. So the relationship of the object to your body is really key. When you're doing your activities throughout your day, you should never twist through your spine. What you should do is pivot over your feet or turn your feet instead so that you're facing whatever direction you're trying to accomplish the activity in. But never do that via twisting, which puts too much stress on your spine. You should plan your moves ahead of time and test the load. If the load is too heavy, then ask for help. You should maintain a wide and stable base of support with your feet rather than your feet being really close and narrow together. Change positions frequently, which I've already harped on and no one's paid attention to yet. And you should lift with your legs rather than your back. So bending at your hips and knees to pick objects up like this and not bending forward at your back. Contrary to popular belief, your back muscles were not designed to lift. They are so small and tiny in comparison to your big thigh and bottom muscles. Those are the muscles that were created and designed to move loads, and that's what we should be relying on to do so. I want to now talk about steps to having a healthier TMJ, since so many people with fibromyalgia and fatigue issues struggle with TMJ dysfunction. So we're going to discuss these 5 things: unloading the jaw, avoiding overstretching the ligament, keeping the tongue on the spot, resting with your teeth apart, and breathing properly. The first step, unloading the jaw. The jaw produces a tremendous amount of force per square inch, and over time this force will wear down your jaw. Obviously, your joint has to be preserved so that you can eat and talk and swallow throughout your life without pain. So what can you do to slow down this wear and tear? You want to avoid activities or habits that put additional pressure on your jaw and overuse your jaw, such as nervous habits that include biting your nails, chewing on the inside of your cheek, chewing on the end of a pencil, cigarette, cigar, pipe, or chewing tobacco. Avoid resting with your chin on your hand. Be careful if you're using a chin strap for those of you who snowboard and rollerblade or play football. You should use a headset when you talk on the phone. if you do so for your job or if you're a big social talker. You want to avoid resting the headset between your head and your shoulder. This puts a tremendous amount of pressure on your neck and your jaw. So if you're someone who talks a lot on the phone, it's worth investing in a headset. And excessive talking, again, whether that be socially or for your job. Just be aware, I'm not trying to tell you never to talk, but just be aware that it can potentially irritate your jaw problem if you do it a lot. Even the foods you eat can irritate TMD, which means temporomandibular dysfunction or temporomandibular disorder. Things that provide no nutritive value, such as chewing gum and ice, or hard and chewy candy like taffy or toffee. Sinewy meat, so this is your excuse when you guys go out to a restaurant to order the finer cuts of meat because it's better for your jaw. Crunchy raw vegetables, carrot sticks, celery sticks, excellent, excellent, excellent for your health, can be potentially murderous for your jaw. So you need to understand that when you're having an episode of jaw pain, you need to avoid these things. Not saying eliminate them forever from your diet, but avoid them. Chewy bagels and breads, because they take a longer time to break down once they're in your mouth. Mixed consistency foods, yogurt with granola, ice cream with nuts on it. The reason for that is when you accept them into your mouth, your muscles around your jaw aren't working. They're just expecting the food to slide down your mouth. Then a piece of granola or a nut gets caught between your teeth and boom, those muscles go into spasm because now they have to work and they were caught off guard. Caffeine is known to increase muscular tension, and so that's something that you guys want to avoid at all costs, and that's why that's listed here. Avoiding overstretching the ligament. There's a ligament that holds a disc in place between the two bones that make up your jaw. That disc has to stay in place to prevent bone-on-bone rubbing from occurring. The rule of thumb in textbooks refers to the fact that your mouth should not open any further than the tip of your thumb will fit between your teeth. But since that's not practical or hygienic to stick your thumb in your mouth, although thank you all for following me, we've talked about the rule of tongue. The rule of tongue refers to the fact that the home base position for your tongue should be the tip of your tongue staying glued to the roof of your mouth. This feels very odd to some people with jaw dysfunction. It does not feel normal or natural, but this is the home base position for your tongue. And if it's not, then havoc will be wreaked on your jaw. So let me just take it from when I say that that's the home base position. Trust me. So we want the tip of your tongue to stay glued to the roof of your mouth at all times, including when you're opening and closing your mouth. So you honestly should never have to open your mouth any wider than you can maintain the tip of your tongue on the roof of it while you are opening and closing your mouth. What types of things overstretch the ligament? Yelling, even yawning, or biting into big, supersized food. Even visits to the dentist. So if you have problems with TMJ dysfunction, you need to let your dentist be aware of it so you can take frequent rest breaks at your dental visits. And unfortunately, some of you might have to undergo general anesthesia during surgery. This is something that if it can be avoided, it should be. Because what they do is they put a tube down your throat and your jaw is jacked open for an extended period of time, however long it takes them to complete the surgical procedure. So if it's ever a situation where you can get a local anesthetic, that should be your choice if you have jaw dysfunction. Out loud together to evaluate your tongue thrust tendencies. T, D, N, L, S, and Z. So what a tongue thrust is when you're saying any of those letters, if the tongue presses against your teeth at any time, that's a tongue thrust, and that can exacerbate jaw problems. I have a tongue thrust when I say the letter S, so I'll exaggerate that for you. S. Can you see my tongue coming through my teeth? S. Rather than staying behind my teeth as it should every time I enunciate those letters. So one good exercise to try to retrain your tongue is if you notice when you're enunciating a letter, if the tongue is pressing against your teeth, is just to practice enunciating that letter or words with that letter over and over again to try and retrain that tongue to work in the proper manner. I already again alluded to the fact that your teeth should never touch, only briefly during swallowing if they do at all. When your teeth are together, then the muscles that surround your jaw develop tension, which can lead to pain. Also, your teeth can get worn down or broken from that increase in pressure over time. There are 3 types of teeth-touching tension. Bracing is when you're holding tension in your jaw, but your teeth do not touch. Clenching is when your muscles are tense and your teeth are touching. And finally, bruxing is when you grind your teeth together. So what can you do to stop teeth-touching tension if you notice that you have problems with it? The number one thing that you can do is address your posture. Because when you're in poor posture and your head is forward, then your teeth automatically touch. Your tongue will automatically press against the back of your teeth, and you'll get an increase in jaw tension. So just simply correcting the position of your head on your neck can do wonders at relieving the tension around your jaw. You also want to develop an awareness of the development of tension in your jaw muscles. When you notice that you've got tension in those muscles around your jaw, you should just stop what you're doing, mentally stop what you're doing, relax your jaw down, put your tongue back on the spot, lips together, teeth apart, and then resume your activity. Just bring more conscientious awareness to what's going on. And obviously decreasing stress of all kinds, because that helps contribute to teeth-touching tension and muscular tension in general. Now breathing properly. I know it seems like a silly point to discuss, but believe it or not, a lot of us do this incorrectly. And by doing so, we build stress in our upper back muscles. We don't get enough oxygen and blood flowing to the damaged tissues, and this can perpetuate our injury and prolong our recovery. Learning how to breathe properly can decrease mental, emotional, and physical stress, as well as facilitate a deeper contraction of our abdominal muscles and thereby lend support to our spine. So how do we do it? A lot of us breathe either really high and shallow in our chest or really low and deep down into our belly. Doing deep diaphragmatic breathing from a relaxation perspective is actually a good thing. However, functionally breathing throughout the course of your day, that leaves your stomach muscles relaxed, which isn't giving support to your spine. So what you should be doing is sending the breath into your rib cage, where your lungs are housed, where we want the air to go. You want to avoid elevating your shoulders and tensioning your neck muscles as you breathe. Send the breath into your rib cage rather than your belly, almost like you're expanding your rib cage like an accordion, out and in as you breathe. I want to finish up now by talking about exercise guidelines. Do not, as I mentioned before, believe in no pain, no gain. It is simply not right. There is no one-size-fits-all approach to fitness, especially when it comes to conditions like chronic fatigue and fibromyalgia. You should listen to your bodies to avoid overdoing exercise. And if you're working with a trainer or if you're taking fitness classes, you need to make sure that the instructor knows that you have special needs so that they can accommodate them. Exercise regimens that have shown benefits to people with fibromyalgia include strength training and aerobic exercise, Pilates, yoga, and Tai Chi. But again, only if done correctly. It's just as easy to hurt yourself doing these exercise modalities incorrectly. It's critical that you demonstrate proper technique and optimal body alignment in whatever form of exercise that you choose to participate. It will pay off for you to find a skilled instructor who can educate you in these proper techniques in order to prevent injury while exercising. Make sure that you check the instructor's credentials to make sure you're getting the instruction that is necessary to avoid injury. So, if you haven't exercised in a long time, how much should you do? The key is to start gradually and to err on the low rather than the high end of activity levels. A good guideline is to perform the same workout twice. Let's say I haven't exercised in 10 years and I want to start an exercise regimen. So on Monday morning I get out and I walk around the block. That's my exercise for the day. Tuesday morning I'm feeling okay, I want to exercise again. I go and do the same thing, I walk around the block. Then I wake up on Wednesday morning, I'm not hurting. Maybe I can walk around the block faster. Or maybe I can walk around 2 blocks. And always do the same exercise twice to assess how your body's going to respond to what you did to it before you increase it in any way. And that is it. I am finished, so I will answer any questions that you have. And again, thank you for inviting me here tonight. So we'll pass the microphone around if you guys do have any questions, and then I'll address them.
when I go to my back doctor and they take x-rays, the x-ray technologist will say, move it back here, move this up forward, move this down, and she'll get me in just the right alignment that I cannot stay in. And then the doctor says, oh, this is just great, you don't have any problems. Can you go to a doctor that will photograph you like you are and tell you how you can get different? You can be properly in line.
Sure. No, not that. That's the standard way of taking x-rays to see if there are any abnormalities in your spine. They should be able to assess from your standing posture whether or not your posture is correct. So even though he's saying everything looks fine internally in terms of the bones and the discs in your back, it doesn't mean that you're using your body correctly throughout the course of the day. So that's pretty standard, and I don't know of anyone who does things differently, unfortunately. Good question, though.
I'm just wondering if you would go back to your slide on three-dimensional ribcage breathing just for a second and review that slide, because it went a little bit fast and I don't think I got it all.
Okay, what you want to think about is your rib cage like an accordion. This is where you want to send your breath. You don't want to send your breath high into your neck and chest or low into your belly. You're trying to direct the breath into your rib cage, which is where your lungs are housed. So think of an accordion, expanding out and in through the rib cage this way and forward and back this way, creating a sphere. And just sending the breath out and in and forward and back.
Sorry.
Does that help? Okay.
I've been told to address neck pain by doing various stretching exercises with the neck. Not to the extent that it's painful, but tipping the neck in various positions and forward until you feel a stretch.
What are my thoughts on that?
Do you agree with that approach?
I don't do a lot of stretching, especially when you're sitting upright and doing things to kind of pull on your neck to stretch out. I do believe it's important to maintain range of motion through your neck as much as you possibly can, because the neck responds to movement to stay adequately nourished as well. In our clinic, we standardly prescribe range of motion exercises, not in a seated position, which can put a ton of stress and strain on the joints in your neck, but we do them lying down on a partially deflated ball. The Red Balloon, I think, is the name of the toy store that we get these small Gertie balls from, and we have them inflated halfway, and you rest on the ball like a pillow, and when you're lying on top of the ball, then you do your range of motion exercises, little gentle stretching in each direction, and that way you're able to maintain the mobility in your neck without putting a lot of strain and stress on the joints, and that's typically what I prescribe. So you have to, again, see what works best for your body, because what one person thinks is right may not be right for you.
Well, I've been doing these stretching exercises for some time. I still have chronic neck pain.
Yeah. So give the other one a try and see if there's a difference.
Thank you.
You're welcome.
Is there anything you can suggest for restless leg syndrome at night when you just can't?
You know what? I do not. That is not my area of forte. I'm not up on the research on that, and I don't know of any treatment modalities, unfortunately. I'm sorry. I know that some of the therapists in our clinic we utilize a technique called pain reflex release techniques, and it's really innovative. It was designed by a therapist in California, and it addresses the fact that your nervous system controls a lot of these pain symptoms that we experience throughout the day, or in the case of restless legs, creates the movement of your legs because your nervous system is hyperactive. And so we use these techniques to try and calm down the nervous system. I don't know of any of the therapists in our clinic that have worked specifically with restless leg syndrome with this problem. It's the only thought that comes to my mind, though.
Just talk about that technique that you just referred to that some of your therapists talk about in your clinic.
It's called pain reflex release techniques. And it was developed by a therapist or primal reflex release techniques by a therapist by the name of John Imes, and I believe that there's a website if you plug in the name, or you plug in the name John Imes, which is IAMS is how his name is spelled. He felt that many of the pain syndromes that we were getting in our offices, we really had to do with the nervous system rather than simply addressing the bones and the muscles that are traditionally addressed. because the nerves are what control the muscles and therefore control the bones too. So he felt that if we address the nervous system by doing some techniques to get the nervous system to calm down and not be what we call upregulated or working so hard, being hyperactive all the time, that it might help people to recuperate from some of their symptoms that they were going through, whether it be someone who suffered a car accident a year ago but has still never completely recuperated for their symptoms, or people with fibromyalgia and chronic fatigue who seem to be even more sensitive to light touches or other issues that some other people would be. And so it's had really great benefit in our clinic. It's not a modality that we use solely. We combine it with other things, but we found it just instrumental in helping our patients get a lot better.
I was just wondering how you utilize chiropractors.
I don't. I'm a physical therapist. We do things very differently than a chiropractor would. I'm not to say that that chiropractors aren't effective or aren't good, but we have a completely different philosophy, so I typically don't work hand in hand with them.
What's different?
A chiropractor uses high velocity manipulations to try and restore alignment of your body's structures, and the way a physical therapist would address the same thing, we'd use more gentle techniques that wouldn't be able to be called manipulations, because all of the techniques that we do to try and restore your body alignment are within your volitional control. If you contract your muscles, you can stop us from doing what we're trying to do, and that's not the case with what a chiropractor does. The thrusting movements are beyond your control, and you couldn't stop them if you didn't want to. And just from our perspective as a physical therapist, we believe that the gentle movements, the gentle guiding that we use to restore body alignment is less traumatic on your body over time than a high thrust manipulation would be. But chiropractors also do use modalities that we use and try to incorporate exercise as well, although they don't have the specific training in exercise that a physical therapist does. I'm not trying to knock any profession here, it's just very different from what we do.
How does one build their core strength?
The question is, how does one build their core strength? The abdominal drawn and the pelvic elevator that we discussed earlier, learning to activate that core musculature, which is the pelvic elevator and the deep stomach muscles, that's really your number one thing that you can do. And doing other exercises such as Pilates, yoga, Tai Chi, other modalities help you to develop that core strength. But the key is to think about core stability rather than core strength. Because remember that differentiation we made between those two concepts earlier. Yes, the muscles here need to be strong, but before being strong, they need to be stable. That's really beyond the scope of what I'm able to address here today, but working with a trained therapist or a trained instructor to try and get you on an established regimen to address your core strength could be something that you could look into. Not everyone has the same strength deficits. Some people, so I can't prescribe a one-size-fits-all approach. You'd have to be evaluated to see what your deficits are to determine what exercises are the most appropriate. I am a firm believer in customizing the exercises that I give to people. That's why I only gave you 3 exercises here, which I have found that the entire population is in need of from what I've experienced as a therapist, versus me showing you a bunch of exercises that may or may not be appropriate, and if you do them incorrectly, could actually hurt you. So that's the best answer I can give. Sorry about that.
Can you demonstrate how we can make sure we're breathing properly?
Yes, you want to just make that your chest, your neck muscles and your chest muscles are soft and relaxed so that when you breathe in and out, that's not happening. You're not seeing all these muscles working. You're also not seeing your stomach relax out and in when you breathe. You want to keep your belly button drawn into your spine, your neck and chest relaxed, and send. A good way to practice at home is to take a scarf or a belt or a sheet and kind of wrap it around your rib cage, and just not tightening it so that you can't breathe, but just feeling a little pressure around your rib cage and trying to send the breath into that sheet or that scarf or that towel. I came prepared. So just really practicing and using this to enable you to feel what's happening in this region. See if you can feel breathing in and out. Again, it's not going to be big. It's maybe ½ an inch or an inch of excursion in each direction. It's really not very big at all. But making sure that the tension is centered here in your ribs, not here and not here.
Because I know I'm a shallow breather,
Mm-hmm.
and that can cause problems.
It can, absolutely. So the best thing to do for people who are a shallow breather and breathe high into their neck is to practice this activity lying down, because that helps relax some of the muscles around the head and neck a little bit better than doing it sitting or standing. So that's something you might be able to try.
Thank you.
No problem. Anything else? Yes. If you ask a question, I'll repeat it.
All right. What if you have bad knees or one bad knee?
Mm-hmm.
You want to kneel down to pick up something, but you just can't do it.
Right. Then the best thing for you to do in those situations is to ask somebody to help you if you try to lift a load that's lower. Another option is if you have bad knees and the load is light enough, you can do what we call the golfer's lift. That's when you're trying to lift a light object from a low position. What you do is you just let your back leg drift up as you lower down, because this keeps your spine in a correctly aligned position. You're not bending through your back, and you're still able to reach an object from a low position. So that's something that you might be able to try if the object's light enough. Anything else? Okay, well, be safe driving home in this wet weather. Thanks for coming and thanks for having me.